My name is Salima Moore. I am co-founder and chief operating officer at RCA, Relational Coordination Analytics. In the back of the room, I have my colleague, Michael Noce, and we have two people not here with us this evening, co-founder and professor at the Heller School, Jyoti Patel, and our chief executive officer, Don Charsky. Relational coordination helps organizations transform relationships in order to achieve their performance goals. We have a proprietary diagnostic solutions that measures how well people who need to coordinate complex work actually accomplish that. We provide customized reporting that identifies essentially performance differentiators. So strengths that can be leveraged, areas to monitor, and targets for improvement. We were founded here at Brandeis, actually. We're a spin-off from Brandeis in 2013, really at this interesting intersection of research and personal experience. Personal experience in both healthcare delivery as well as the airlines industry. Who here in this room has not had one of those nightmare experiences coordinating between your primary care provider, your specialists, referrals, pre-authorizations, billing representatives in your insurance companies? Exactly. And the thing is, you don't really realize how layered and complex that process is until it's you that has to navigate that sea of providers, or it's you sitting down with that pile of bills that you have to sort through. There's a similar parallel in the airline industry in the sense that who here has not arrived an hour and a half ahead of schedule like they tell you to do at the airline, only to find that your flight has been delayed, canceled, or that your gate has been changed, right? Or who has had that even worse experience where you land on time, but your luggage and toothbrush end up somewhere else. And again, what's frustrating about that experience is that you don't really realize how complex it is and how many people and things need to coordinate until it's you with no luggage, and till it's you with a canceled flight. So what is that thing, basically, that distinguishes the positive healthcare experience, right care, right time, or getting to your final destination on time with your luggage in tow, from those horrible experiences that we've all had at one point in time, and probably have had one too many of? It turns out that thing is called relational coordination. And by the time that RCA was founded in 2013, Professor Jyoti Patel had actually already spent a decade basically studying these complex settings where work is interdependent, or in other words, you can't produce the outcome by yourself, where there are time pressures, you don't have 5 years to figure out a solution to the problem, and where there's uncertainty, right? Information, things, context is changing all the time. And what she found that is in those settings, this thing that we can actually measure called relational coordination positively impacts a range of performance outcomes. And not just the ones like productivity and efficiency and quality, but things that are important to each one of us in this room, right? Things like customer experience and satisfaction, things like employee engagement and satisfaction. So by the time the company was founded, we found ourselves really wrestling with this question of, well, wait a minute. Why can't we use what we know, what we've learned, and what we've been able to measure to address one of healthcare's biggest challenges? And that's the challenge of poor coordination. Unfortunately, coordination is not only normal, it's also costly and very dangerous. And to exacerbate that problem, existing solutions that are intended to help healthcare stakeholders work better together are actually either function or role specific, extremely long to complete, and the results that you get are difficult to act on. What distinguishes the RCA solution from those solutions are a few things. One is that our instrument is validated, reliable, and unbounded. The second is that it's elegant. So you don't have to answer 50 or 65 questions to figure out those key dimensions, those key performance indicators that are not working well, that are working extremely well. And finally, and most importantly, it's this idea is that we treat a complex process as a series of interconnected parts, where coordination is actually really critical at those points of handoffs and transitions. And not only do we treat it that way, it's actually built into our methodology and built into our algorithms, and it's the way that we approach all of our client engagements. You can either use results to look really big picture, how's my organization doing? Or you can get really granular and look at dynamics between particular roles or functions. As a company, we've been very, very fortunate in terms of the organizations that we've worked with. And where we are going next is that we are actually doing two things. One, we're expanding our product features and functionality, especially to be more accessible and available to smaller provider organizations. And the second one is partially why we're here this evening. We've been so focused on building a really great, rigorous, easy-to-use product that we actually have not done a great job at marketing. And so looking ahead and looking forward over the next year, we will be participating in opportunities like this, but also just working a little bit harder to get the word out about our company and the awesome things that we do. Thank you. To learn more, go speak with Mike in the back of the room. Obviously, follow up on our website or shoot us an email. It's so clear that there are no questions. That's incredible.
So what do you actually sell? Is it a service?
It's a measurement and software solution. The foundational element of that solution is this proprietary validated instrument, and then we accompany that with a platform that you can use to manage your engagement.
So is it a consulting fee? Or
It's a software. There is an element of consulting just in terms of onboarding and setup, but the product and the solution is user-driven. Self-service.
So you measure something to do with how these people are interacting, and you find what's not working. Now, you must be a part of your system that gives feedback to try and correct that? You haven't talked
So
about that.
the answer to that question is both, of course. We have a couple of different service models. One is where you are licensed, you are trained, and you can do that work yourself. Because, well, one of our philosophies is that you know your organization better than we do. So we can provide the expertise on the measurement, the analytics of reporting, and the interpretation, but you have the experience with your audience. The other model is a more consultative and coached engagement, where it is us who primarily goes in and does that work with clients. We try to meet essentially organizations where they are. Some are ready for the self-service model entirely, and some are not, especially our smaller clients.
Okay, great, thank you.